1. A certified therapeutic crisis intervention TCI trainer is mentoring a new staff member. The staff member becomes overwhelmed during a role-play scenario and shuts down. Which mentoring strategy would be most appropriate in this moment? A. Increase the complexity of the scenario to push the trainee beyond their comfort zone. B. Pause the scenario and conduct a debrief focusing on emotional safety and self-awareness. C. Restart the role-play without acknowledging the trainee's emotional response. D. Assign the trainee to observe another trainer's session instead of participating further. 2. During an adult learning workshop on TCI strategies, a participant challenges the relevance of the material. What should the facilitator do first? A. Remind the participant that the material is required by policy. B. Ignore the comment and continue with the session. C. Engage the participant by linking the content to real-world outcomes and job performance. D. Ask the participant to hold questions until the end. 3. Which evaluation method best measures the effectiveness of a TCI training session in transferring knowledge to real-life practice? A. Post-training written examination. B. Supervisor feedback 3 months after training. C. Participant reaction survey at the end of the session. D. Attendance records of all participants. 4. In the context of regulatory compliance, what documentation is critical to demonstrate adherence to mandated TCI training standards? A. Employee self-assessment forms. B. Signed confidentiality agreements. C. Completed trainer evaluation forms and certification records. D. Informal trainer feedback logs. 5. A TCI trainer is tasked with developing a new curriculum module for de-escalation techniques. According to curriculum development best practices, what should be the trainer's first step? A. Write learning objectives based on staff feedback. B. Review existing incident reports to identify training gaps. C. Design the PowerPoint slides for delivery. D. Prepare assessment tools to measure outcomes. 6. A trainer is facilitating a TCI session with adult learners from various cultural backgrounds. To foster inclusive communication, the trainer should A. Avoid addressing cultural differences to maintain neutrality. B. Use standardized terminology without deviation. C. Incorporate culturally responsive scenarios and examples. D. Focus on technical definitions rather than lived experiences. 7. Which scenario best illustrates the application of the adult learning principle of self-direction in TCI training? A. Learners follow a strict script during role plays. B. Learners choose which de-escalation techniques to demonstrate based on prior experience. C. The trainer delivers all content through lectures. D. Learners are tested only through multiple choice exams. 8. During a TCI training, an experienced staff member dominates discussions and interrupts others. What facilitation strategy is most appropriate? A. Allow the staff member to continue sharing since they have experience. B. Redirect the conversation by inviting quieter participants to contribute. C. Skip group discussion to avoid conflict. D. Confront the staff member in front of the group. 9. A regulatory audit requires proof of trainer qualifications. Which documentation is most relevant? A. Copies of participant certificates. B. Trainer's resume and ongoing professional development records. C. Pre-training questionnaires. D. Participant learning style inventories. 10. A newly certified TCI trainer is unsure how to handle a participant who resists practicing physical interventions. What should the mentor suggest? A. Enforce participation through policy citation. B. Create a supportive dialogue exploring the participant's concerns. C. Remove the participant from training. D. Ignore the resistance to avoid confrontation. 11. What is the most effective formative assessment strategy for gauging understanding during a TCI physical intervention workshop? A. Exit survey after training. B. Observation checklists used during skill demonstrations. C. Certification exam at the end of the course. D. Training feedback forms. 12. A TCI curriculum includes a lesson on the stress model of crisis. To enhance retention among adult learners, which instructional methods should be prioritized? A. Memorization drills. B. Case-based learning and reflection activities. C. Passive video viewing. D. Rapid-fire questioning. 13. When developing learning objectives for a TCI training, what characteristic ensures they are measurable? A. They are broad and conceptual. B. They focus on learner satisfaction. C. They describe observable and accessible behavior. D. They include subjective interpretations. 14. During a mentoring session, a trainee expresses discomfort with physical contact during TCI physical skills. What is the mentor's best course of action? A. Require full participation regardless of discomfort. B. Adjust the training plan to accommodate the trainee's needs while maintaining standards. C. Delay training until the trainee is comfortable. D. Remove the trainee from the certification program. 15. Which communication technique is most appropriate when debriefing a failed TCI physical intervention attempt during training? A. Criticize the group to prevent future errors. B. Focus solely on the steps missed. C. Use reflective questioning to encourage group problem solving. D. Avoid discussing the failure to protect morale. 16. A TCI trainer notices a discrepancy between the training curriculum and current regulatory requirements. What should the trainer do? A. Continue using the curriculum to avoid confusion. B. Notify the training supervisor and update materials as needed. C. Wait for formal curriculum changes before adjusting. D. Inform trainees verbally but use outdated materials. 17. Which best exemplifies a mentoring goal in the context of TCI trainer development? A. Ensure the trainee memorizes the manual verbatim. B. Provide opportunities for the trainee to observe only. C. Build the trainee's confidence and independence in delivering content. D. Limit feedback to final evaluation. 18. When conducting a summative evaluation of a TCI training program, which tool provides the most valid data? A. End-of-course participant satisfaction survey. B. Pre- and post-training knowledge test comparison. C. Trainer opinion survey. D. Participant attendance log. 19. A TCI trainer is preparing staff to handle a potential crisis situation involving a child with trauma history. Which training approach is most effective? A. Emphasize policy adherence only. B. Use a trauma-informed case study with discussion prompts. C. Deliver a lecture on behavior management. D. Review documentation procedures. 20. A TCI trainer wants to evaluate the impact of training on workplace incidents. Which metric is most relevant? A. Number of training hours completed. B. Participant feedback scores. C. Reduction in restraint usage over time. D. Number of attendees per session. Therapeutic Crisis Intervention Certification. The Therapeutic Crisis Intervention TCI certification tests assess the knowledge, skills, and competencies of individuals trained to implement the TCI system, a crisis prevention and intervention model developed by Cornell University. These high-stakes assessments evaluate a candidate's ability to apply trauma-informed, developmentally appropriate strategies to prevent, de-escalate, and manage crisis situations safely and therapeutically. The tests cover key areas such as behavior support techniques, crisis communication, de-escalation strategies, post-crisis response, and physical intervention methods. Certification ensures that practitioners meet rigorous standards for creating safe, supportive environments for children and youth in residential, educational, and clinical settings. Here are the top 5 beneficial uses of Therapeutic Crisis Intervention exam. 1. Ensures staff competency. TCI certification tests validate that staff possess the necessary skills and knowledge to prevent and manage crises safely and effectively, supporting high standards of care. 2. Promotes safer environments. Certified personnel are better equipped to de-escalate potentially volatile situations, reducing the risk of harm to both youth and staff. 3. Supports trauma-informed practices. The certification reinforces the use of compassionate, evidence-based strategies that recognize the impact of trauma on behavior, fostering more therapeutic interventions. 4. Enhances program compliance. Certification helps organizations meet legal, regulatory, and accreditation requirements related to crisis management training. 5. Strengthens professional development. TCI certification contributes to ongoing staff growth, improving confidence, accountability, and overall job performance in high-stress environments.